Welcome to the latest episode in our body system series. Today we are looking at the circulatory system. The circulatory system consists of the heart, blood vessels, and of course blood. The circulatory system is further divided into two circuits, namely the pulmonary circuit and the systemic circuit. The pulmonary circuit is where blood circulates between the heart and lungs. Coming out of the lungs, the newly oxygen-rich blood is returned to the heart, where it is pumped into the systemic circuit. The systemic circuit is primarily responsible for carrying blood between the heart and the peripheral tissues. So now let's look at each part of the circulatory system. First of all, the heart, which is responsible for pumping blood throughout the body. The heart consists of four chambers. The two at the top are called the atria, and the two at the bottom are called ventricles. The atria receive blood returning back to the heart, while the ventricles push blood out of the heart. Valves in the heart ensure that blood flows in the right direction. The heart pumps about 5 liters of blood every minute, which is known as the cardiac output. The cardiac output varies according to gender and degree of activeness. Second come the blood vessels, which consist of 3 kinds, namely arteries, veins, and capillaries. Arteries are characterized by having thick walls able to tolerate blood flow under high pressure. This is due to the wall's ability to constrict and dilate. They are primarily responsible for transporting oxygenated blood away from the heart to the tissues. Veins, on the other hand, have thin walls and valves to ensure that blood does not flow backwards. Veins transport blood from the tissues towards the heart. Capillaries, which are microscopic and found in the muscles and lungs, have extremely thin walls which are only 1 cell thick. Blood moves much slower and under very low pressure here. This ensures that gas, water, waste and nutrient exchange can occur. Third, we have blood, which is a combination of 4 major parts, namely the plasma, red blood cells, white blood cells and platelets. The plasma is the fluid that surrounds the blood cells and assists in transporting carbon dioxide, hormones, and metabolic waste products. Red blood cells are formed in the bone marrow and are responsible for transporting oxygen. They are also known as erythrocytes. White blood cells are also formed in the bone marrow and are a major part of the immune system. They create antibodies which help detect and kill harmful microorganisms. They are also known as leukocytes, and they are formed in the bone marrow too. Platelets are cells that organize, form blood clots, and thus help stop bleeding. If a blood vessel is damaged, a signal is sent to the platelets. Platelets then accumulate at the site, forming clots to stop the bleeding.
Did you know atherosclerosis, which is a hardening of the arteries, is a common circulatory disease? It is typically caused by a diet high in fat, which leaves fatty deposits on the lining of the blood vessels. These fatty deposits stick together and make the arteries hard and less flexible. Usually, patients won't have any symptoms until an artery is so narrow and clogged that it can't supply adequate blood to the organs and tissues. If a blood clot completely blocks the blood flow, this might trigger a heart attack or stroke. Symptoms of moderate to severe atherosclerosis will vary depending on their location in the body. For example, patients might experience chest pain or pressure, angina, if atherosclerosis is in the heart arteries, and if it's in arteries leading to the brain, one might experience sudden numbness or weakness in the legs and arms, difficulty speaking, temporary loss of vision in one eye, and drooping muscles in the face. In addition to this, if the arteries lead to the kidney, the patient might develop high blood pressure or kidney failure. For diagnosis, patients usually undergo physical examinations, and health professionals usually look for a weak or absent pulse below the narrowed area of the artery. Additionally, they look for decreased blood pressure in an affected limb. Depending on the results, blood tests might be needed to detect cholesterol levels. A Doppler ultrasound might be used to measure blood pressure. An electrocardiogram, a stress test, cardiac catheterization, and angiograms might also be needed depending on the seriousness of the condition. As for the treatment, various drugs can slow or even reverse the effects of atherosclerosis. Cholesterol medications can slow, stop, or reverse the buildup of fatty deposits in the arteries. Other medication options include antiplatelet medications and beta blocker medications. There are also surgical options which include angioplasty and stent placement, or bypass surgery, which allows blood to flow around the blocked or narrowed artery.
Now, for the main functions of the circulatory system. The circulatory system ensures that blood is pushed throughout the body and supplies oxygen to the tissues of the body through the systemic circuit. The circuit is also used to get rid of carbon dioxide, unused nutrients and waste from the body. It also protects the body from infection by deploying antibodies to the infected site. The circulatory system helps the body maintain a constant body temperature, thermoregulation, as well as maintaining fluid balance within the body by regulating the blood flow. The flow of blood is controlled by the ability of certain blood vessels to constrict or dilate their walls according to the need of the body. Finally, the circulatory system in relation to other body systems. The circulatory system works in unison with the respiratory system to transport oxygen via the blood through the body. The circulatory system depends on the lymphatic system to help maintain the blood volume by returning body fluid back into the blood. The immune system makes use of the circulatory system to transport life-saving antibodies to sites of infection in the body. With that, we conclude our lesson today on the circulatory system.